Hello and welcome to Sectors Up Close. I'm Vincent McAviney. Our focus today is on the US healthcare sector, and my guest is John Stoltzfus, the Chief Investment Strategist at Oppenheimer Asset Management. Healthcare stocks are back in focus as an end to pandemic restrictions in many countries is expected to boost demand for healthcare services. The sector is worth a whopping $4.9 trillion and includes healthcare providers such as United Health, pharmaceutical companies such as Pfizer, as well as diagnostic and other equipment makers like Thermo Fisher Scientific. In the roughly 2 years since the start of the pandemic, this index is up 22%, much of that down to the performance of vaccine makers like Pfizer. This sector lagged the wider S&P 500, which gained 29% over the same period. Recent analysis by Standard & Poor's said that while its outlook is improving, there are a number of risk factors to watch out for. They include wage and inflation pressures, a limited pipeline of new drugs, as well as a surge in M&A activity. So how should an equities investor view the healthcare sector? Well, let's ask John Stoltzfus of Oppenheimer Asset Management. John, thank you very much for joining us today. Firstly, let's start with your view on the sector now the pandemic is, we hope, coming to an end. Shall we assume that there will be some tailwinds?
We would assume that there will be tailwinds. We don't think those tailwinds will be coming from pandemic-related issues, but rather related to a more normalization of demand within healthcare, whether it's for diagnostic services, whether it is for treating severe chronic diseases, or whether it has to do with things like plastic surgery to look younger, perhaps, the elective surgery type things. Dental, people will be going back to the dentist again as they feel more comfortable going outside of their homes into a public place that is a hospital or a doctor's office, where a large cross-section of the population exposed to many illnesses can gather.
Well, let's talk about some of the risks here. Wages, inflation and higher rates. How will this sector be affected when compared to the wider market?
We'd have to think, Vincent, that inflation is most certainly going to be a factor for healthcare. The fortunate thing is within healthcare, the healthcare services and providers have moved even more towards technology than they have in prior years, to the extent that we've got telemedicine occurring, whether it's someone on a Zoom service speaking with their doctor, which can eliminate the need for excess staffing to meet office management of people coming in for appointments or what have you, as well as the relative ease that a physician can move from one patient to the next within Zoom calls. To diagnose things and to see if it needs to be a one-to-one kind of thing. Also, robotics for surgery likely to increase significantly. All kinds of efficiencies that can occur in the production of medicines, not solely vaccines, but all types of prescription or ethical pharmaceuticals that make sense. I think the one thing that's important to remember that within the XLV, which is the traditional spider sector that many people look for when looking for diversification within the S&P 500, about 9% of the sector it results in exposure to biotechnology. And biotechnology is what has really drastically underperformed over the last year and this year as well, in that there's been a pullback. And biotech was a big play in the success of the meeting the needs of vaccine developments in the height of the pandemic and in the 9 months that preceded that. But now moving forward, biotech is sort of, I think the market is saying, show me your next trick to biotech. And as a result of that, the fast money has pulled out, but we think that it offers upside moving forward as developments come across the proverbial transom.
And can you break out the subsectors? So you've got equipment makers versus healthcare providers versus drug makers. How do you differentiate between them?
Well, I think the most important thing to remember in the S&P 500 sector exposure within that sector, it really is primarily traditional pharmaceutical companies, some exposure to insurers, as you just said, medical equipment, but very small exposure relative to biotechnology, which is the secular driver of future developments. So we would rate this sector essentially a market perform type sector. We're not looking for great outperformance, but we think the dividends the traditional pharmaceuticals provide are something that should be considered by many investors who are looking for income, as well as exposure in an area that offers upside. Market performance does not imply underperformance. It may not be the sexiest part of the market to be invested in at this time.
John Stoltzfus, the Chief Investment Strategist at Oppenheimer Asset Management, thank you very much. Before I go, here are some of the top stories in the healthcare space. Hong Kong leader Carrie Lam said she will roll out compulsory testing for COVID-19 starting in mid-March for its 7.4 million residents, as university researchers predicted new infections could peak at a staggering 180,000 a day next month. Residents would need to test 3 times under the compulsory testing scheme, with daily testing capacity reaching 1 million. Hong Kong's zero COVID policy contrasts sharply with that of the UK, which on Monday announced it was ending all coronavirus restrictions, including the need to self-isolate from Thursday this week. AstraZeneca said its Enhertu cancer drug will help patients suffering from a type of advanced breast cancer live longer. The drug maker described the improvement as, quote, clinically meaningful compared to standard chemotherapy. AstraZeneca said it would now reach out to regulatory agencies to enable a speedy review of wider use of the drug. And China has warned consumers against buying certain infant products made by Abbott Laboratories that were affected by a recent recall linked to a US factory. The US FDA on Friday issued its own caution after Abbott said it was recalling powdered baby formulas, including Similac, after 4 consumers complained about bacterial infections in infants who had consumed them. The affected products were not sold in China, but China Customs warns some consumers may have bought them from online overseas vendors. And that is your roundup of the healthcare sector. I'm Vincent McAviney, and this is Reuters.